Hello everyone, in this video I will be performing bag technique and urine testing. So I will perform first the bag technique followed by the urine testing, and let's get on to the video. So today we will be assuming that I am in a healthcare center, and after that I'm going to prepare the materials or the articles needed for the visit. And then I'm going to clip the plan of visit outside the corner of the bag. And I'm going to meet the family that I'm assigned to. For our bag technique, we are going to clean first our bag and then prepare all the materials that we're going to put inside the bag. And the following are the list of materials and the proper sequence on where to put these materials. Inside the front pocket of the bag, a digital thermometer, disposable syringes, and disposable needles are to be placed. On the right side of the bag, from rear to front, test tubes that are wrapped in paper towels should be placed. A test tube holder, a medicine dropper, a matchbox, and an alcohol lamp with denatured alcohol as well. Next, on the left side of the bag from rear to front, medicine glasses with suction inside and a baby scale should be placed. On the back of the bag from left to right, a betadine solution, a 75% alcohol bottle, a Lysol solution, spirit of ammonia, Benedict solution, acetic acid, and a plaster should be placed. On the center of the bag, from top to bottom, a kidney basin should be placed first, and then a Kelly straight, a Kelly curved, an umbilical scissor, and a bandage scissor should be placed inside the kidney basin. And inside the bag, sterile gauzes, tongue depressors, cotton applicators, and cotton balls should be placed. And then a hand towel is placed on top of the bag. A soap dish and soap should be placed on top. And to be followed by an apron on top of the soap dish. At the next portion of the bag, on the top pocket, a sterile and wrapped gloves shall be placed. As well as a waste receptacle and a plastic bag. And lastly, at the top of the inner cover, a paper lining of 14 by 20, a plastic lining of 13.5 by 19.5, and a paper lining of 12.5 by 18.5 shall be placed inside the pocket. And now we're done. After greeting the family members and client, look for a clean area. Now that I have found a clean table, I'm gonna hold the bag and take out the paper linings and the plastic lining. Now I'm going to place first the bigger size of paper lining, and next will be the medium-sized plastic lining, and lastly I'm going to place the small paper lining on top of the two linings. And now I'm going to place the bag on the left side on top of the paper lining, tucking the handles under the bag. And then I'm going to open the bag and take out the soap dish with soap, the apron, the hand towel, and the waste receptacle. And then I'm going to close the bag. Remove watch or any jewelry and place it inside the pocket. I'm going to wash my hands and wipe it dry. After washing my hands, I'm going to leave the soap dish and towel in the washing area. And I'll be wearing gloves. Hold the apron on the folded part with the left hand and look for the straps with the right hand. And I'm going to drop the apron, making sure that it will not touch the things of the patient and especially the floor. And then I'm going to put on the apron, slipping the head first and then both hands to the straps. Test for albumin in the urine. I'm going to open the bag and the inner cover, removing articles that I'm going to need for the procedure and care of the client. I need an alcohol lamp, a bottle of acetic acid, test tubes and test tube holder, a match, a dropper, and a syringe without the needle. And don't forget the fresh urine. So the first thing that I need to do is to heat the alcohol lamp. And I'm going to fill the test tube 2/3 full of urine. To transfer the urine from the container to the test tube, I'm going to use a syringe. Using the test tube holder, I'm going to clamp the test tube filled with urine, and then I'm going to heat it until it boils. Hold test tube against the light and examine for cloudiness or change in transparency. If cloudiness appears, I'm going to add 3 to 5 drops of acetic acid and heat it again. Allow it to stand for a few seconds, and then I'm going to check the color, interpret it, and I'm going to document the results. Test for sugar in the urine. In this test, I'm going to set aside the acetic acid and replace it with Benedict solution. First thing to do is to place 5 ml of Benedict solution in a test tube using a new syringe. And then I'm going to hold the test tube over the flame and bring it to a boil. And then I'm going to add 2 to 3 drops of urine and heat it again until it boils. Allow it to boil for 5 minutes, then stand for a few seconds. And now I'm going to check the color, interpret it, and document the results. After performing, wash and clean equipment. If washing is not possible, place the articles used in a separate bag to be taken back to the health center to clean. After washing and cleaning the equipment, I'm going to wash my hands. After washing my hands and drying them with a towel, I'm going to keep and bring with me all the materials that I have washed, including the soap dish, the soap, and the towel. And then I'm going to open the bag for the last time and return the clean articles in the bag. And then I'm going to take off the apron, holding the side by the waistline of the apron, and fold without the straps in the center with the contaminated area inside. Then fold the straps crosswise along the outer side of the apron. Fold again crosswise, placing it inside the bag and closing the bag. And then I'm going to ask a family member to burn the paper waste box. Carrying the bag, I'm going to pick the top paper lining and plastic lining and fold with the contaminated area inside. Picking the bottom paper lining on the center and fold with the contaminated area inside. I'm going to insert it inside the bag on top of the inner cover. And don't forget to record the visit. Now, I'm good to go. And that is my bag technique and urine testing return demonstration. Thank you all for watching.